Good morning. This is John Robinson from Asian News. Dr. Khilnani is with me this morning, and we just wanted to see and we just wanted to know that what exactly is the ratio is there for this asthma in India and NCR, Delhi, and globally. What will you say for this asthma, Doctor?
Asthma is an allergic tendency which occurs in 3 to 10% of the world population. It doesn't mean that 3 to 10% of people are wheezing all the time or coughing all the time. It's a tendency which is genetically determined, and whenever there are adverse circumstances, which could be in the form of exposure to dust, change of season, exposure to air pollutants, exposure to pollens, and so many others which can trigger asthma attack, and it comes in the form of cough, wheezing, breathlessness, and chest tightness. Patient has to sit up at night for better breathing, and classically it responds to inhalational therapy.
What will you say, to prevent, for the prevention of these things?
The most important thing is that person has to realize that he has this tendency. The diagnosis is important. The diagnosis comes from a good history and also examination by a physician. Also, we do lung functions, which is called spirometry. The lung functions will actually measure the size of the tube. That means during the asthma attack, the airway become narrow, and that is documented by spirometry. Once it is diagnosed, it is important to know what are the triggers, and as I said, these triggers are best recognized by the patient. Sometimes the allergy testing is also necessary. Once you recognize the triggers, it is important to avoid these triggers, and those who get frequent attacks should take regular treatment in the form of inhalers.
What is the difference between asthma and TB, tuberculosis?
Asthma is an allergic tendency, whereas tuberculosis is an infection caused by Mycobacterium tuberculosis. And tuberculosis presents as fever, cough, expectoration of blood, and also chest pain. And tuberculosis is diagnosed by X-ray and sputum examination, whereas asthma is not an infection. It's an inflammation which is caused by various agents.
So, how much a ratio is there for the, if you figure out the children's and the adult and the women and the girls?
Asthma most commonly starts in the early childhood or even in infancy, but it can actually start at any age. Even 8 years old person can have first attack of asthma. As far as the pregnant woman is concerned, 1/3 of the pregnant women will have increase in their symptoms. 1/3 of the pregnant women will have decrease in their symptoms, whereas 1/3 of the women will not be affected by the pregnancy. Now it is important to realize that if the pregnant woman gets frequent attacks of asthma, then the growth of the fetus is retarded. So therefore, it is very important to have a good control of asthma during pregnancy.
Thank you very much, Dr. G.S. Khilnani. He is the head of medical AIIMS, which you call that, All India Medical Sciences in India, and really it's a very useful information for all the people, those who are looking for all these things. Thank you very much, Dr. Khilnani.
Thank you.